Okay, you can begin the session.
So, good evening, everyone. So, thank you, Hindi team. Now we are going to the English session. So, today IFPH is conducting its 2133rd day of uninterrupted daily webinar series. Before starting, 1 minute silent prayer. Thank you. So, we are welcoming you all to this wonderful platform once again. And today, our guest is Dr. AMAR THAKKAR, HOD Professor, Department of Pathology, Rajkot Homeopathic Medical College, Rajkot. And he is going to say about AI. Today, we all know that everywhere we can see AI. So, how this AI can influence in homeopathy? So, we are expecting a wonderful speech on this AI. So, we are welcoming heartily from our heart to this wonderful session. Dr. Amar Thakkar, you can please come to this dais and you can start now. And the subject is changing the role of homeopathic physician in the age of artificial intelligence and rapid technological advancement. So let us hope we are getting a wonderful speech about this. Please, sir, you are welcome. Thank you.
Very good morning to all present in this webinar. Thank you very much, Dr. Shi, for introducing me and presence in the webinar as a guest. Thank you, Dr. Dinesh, and the entire IFPH team who has taken this pain to conduct a webinar for such a long period of time. So, without wasting much time, as the topic which I have selected today is in the age of artificial intelligence and rapid technological advancement. So, as Dr. Shi told that there is AI. So, first of all, I would like to clarify that we are not only going to talk only about AI. There is simultaneous rapid technological advancement going on in the field of medicine along with AI. So, of course, the buzzword around us everywhere we are hearing AI. And as clinicians, we should be well aware with how best we can use this artificial intelligence and the rapid technological advancement which are taking place. So this topic, why I selected, first of all, I would like to throw some light that in today's time, it is a very significant topic because everywhere we go, we are coming across this word technology and artificial intelligence. So how can a homeopath be untouched by it? So that is the first and basic reason. The second reason is that homeopathic system of medicine has been here since last 400 years. Now, over a period of time, there has been changes to which homeopathic physicians have not adapted as rapidly as what we are seeing today. In terms of adoption of artificial intelligence and technological advancements, both should be done because, as I told you, homeopaths are little reluctant to go ahead with whatever changes are taking place. But I feel personally that artificial intelligence and rapid technological advancement are going to be very important. They are important and they are here to stay, and they will enhance medical practice. So without wasting much time, I would like to start with the presentation. Am I clearly audible? Now I'm starting to share my screen.
Yes, yes.
Audible.
Yes, now start with Dr. Dinesh. Yes.
Yes.
Is Kiran sharing this?
Yes.
Good.
Yes. We can.
Sorry, there had been a power cut
Yes, sir. No problem, sir. You can speak. One
So,
or junior doctor is sharing now for you.
okay.
You can speak from the phone.
No, now I think it is. Now I'm online.
Yes, yes.
Is my screen visible?
Yes, sir. It is visible. Can you see it? Already it is.
Okay. Yes. Yes. Yes.
The first page is visible. Can you see, sir?
Yes.
Yes.
Okay. So yes, I was talking about artificial intelligence and rapid technological advancement. So we are looking at the time when there are smart solutions available to help us because of the digital evolution which has taken place. But how should the homeopathic physician adapt and thrive in this new era? That is a big question. Why? Because homeopathy has always been a patient centered system of medicine. So, our core is always a human being, and adding technology, smart solutions, words like that has been always at the back of a mind as a you can say problem, or rather a hesitant uh, action for a homeopathic physician. So, since a homeopathic physician is traditionally involved in the processes like case taking, detailed observation, repertorization, analysis of symptoms, how to integrate all this is a big challenge. And we always think in terms of the human being aligned to this modern inventions, digital evolution, and smart solutions. So, today's topic, or rather today's presentation, and the whatever I'm going to talk about today, is with the purpose that by the end of this webinar, all those participants who are attending this webinar, doctors, students, my colleagues, they should understand that the current technological changes which are affecting the healthcare, they have to be incorporated at some or other time by us. And there are wonderful opportunities which AI can offer to us. And no homeopath should refrain himself from adopting this technological advancements. However, at the same time, this webinar is also a highlight that there is certain amount of risk which is associated with excessive dependence on technology. And we must be well aware that risk management is always a big part in any field you take. So it applies to homeopathic physicians also when they adopt any technological advancement or artificial intelligence. They must be well aware of the risk it possesses, because we are going to adopt AI and technological advancement at the same pace at which the world is moving. There needs to be certain skill sets which a homeopathic physician has to develop. They are part and partial of adopting artificial intelligence and other technological advancements. And by gaining sufficient knowledge pertaining to this particular aspect, we have to always remain relevant. That is to say, get updated time and again, because this AI and technological advancements are going to further rise rapidly. So many homeopathic physicians might be wondering now that will AI replace doctors? Will processes like repertorization, analysis, and evaluation of symptoms will become completely automated? Will patients trust machines more than the physicians? And what skills should the future doctor possess? At the end of this webinar, you will be rest assured that technology will not replace homeopathic physicians, doctors, medical personnel. But doctors who will use this technology wisely will replace those physicians who will not. That is going to be the central idea with which we will be moving towards understanding of this particular webinar. In order to understand application of artificial intelligence and technological advancement as we stand today, we have to compare the traditional era with digital era. Traditionally, homeopathic physicians were relying completely on organon of medicine, materia medica, repertory, their own clinical experience and careful observation, along with lot of patience and intuition. As a result of which, the physicians were very good observers, listeners, counselors, diagnosticians, and very importantly, family advisors. A large part of our information and clinical acumen, what we possessed in traditional era, that was highly dependent upon memory, clinical observation, and experience which homeopathic physicians collected for a period of time. And we have seen as homeopaths gradually increase their experience, their clinical acumen, their ability to listen, their ability to observe gets enhanced quite reassuringly. So that was the traditional era. But now with changes pertaining to digital era, we must be well aware that now there has to be a change, because there is easy access to information through internet. The world has become very small. We now have a lot of information online available with respect to many innumerable number of books in digital form, so many magazines, journals which are available, AI assisted searches. Now we'll talk about artificial intelligence separately, but previously we used to go for browser assisted searches. Now we have AI assisted searches. And nowadays we see electronic records being maintained by homeopathic physicians. There is a great rise in what we now call as teleconsultation, especially after the COVID era. And in modern medicine, there is presence of wearable health devices. Even laymen are using wearable health devices to track their health status. And there are so many mobile applications which are available, which can be accessed very easily, used easily. And very importantly, the first affected field from AI and technological advancements was digital imaging. So this is the difference which we have between traditional era, in which a homeopathic physician completely relied on those points, or rather those factors which are of course relevant, but they can be enhanced and improved with digitalization. Again, because of this, now instead of information, physician acumen is more important, that how he interprets this information and how he utilizes this interpretation, on the basis of which he takes judgment, and at the same time applies all these learnings which he has gathered from this digitalization, so that it can be implemented in homeopathic practice. So this is pertaining to evolution of a homeopathic physician. Now, as I told you before also, that whenever we talk of digitalization, the first and foremost thing which comes to us is artificial intelligence. But AI is not only ChatGPT, or digitalization is not simply AI now. It involves sort of so many different things in form of machine learning, deep learning, natural language processing, image recognition, predictive analytics. Now, this may seem a little bit jargon for a homeopathic physician if he's not aware or is not with current trends in technological advancements. But all this is being now very well incorporated in homeopathic system of medicine. And we have specifically different AI engines which are helping a modern physician, a modern homeopathic physician for several purposes. But of course, modern medicine has initiated this. So already AI is assisting in radiological investigation, interpretation of pathological reports, even histopathology, ECG interpretation, dermatology, medical documentation, drug discovery, and clinical decision support. However, because homeopathic system of medicine understands the patient, at its core it is the patient. So when we think of a patient, we think of compassion, morality, intuition, responsibility, and accountability, which AI is lacking as of now. So this much information pertaining to AI in healthcare is sufficient for a homeopathic physician in order to understand the application of AI and modern technological advancements in homeopathic system of medicine. Now we come to the part where we try to understand how AI can enhance homeopathic practice. So the first and foremost thing which you must understand that AI presents to us with the biggest time saver. The time factor is one constant, you can say, dilemma which a homeopathic physician faces because he invests a lot of time in processes like case taking, repertorization, analysis and evaluation, even writing down the case. So all this comes to a time when a lot of time is invested in a single patient. And for that, AI can help us very well. So starting from all those different processes, let us say, for example, repertorization. We have been using modern software since a long period of time. But with AI, software programs have become more refined, fast, and there are specialized AI-centric softwares available now, which not only cuts the time, but are also having more excellence as far as the repertorial results are concerned. The second is materia medica search. Comparison of medicines has always been a big task, which a homeopathic physician has over and over invested a lot of time in order to select a simillimum. So now with the help of AI, very easily a set of drugs which are very similar can be very easily compared at the click of a button. Not only that, group remedies, so many things for which we used to invest a lot of time now can be done very easily. The same is with case documentation. We used to write down the case, as our master said, by maintaining the same language and leaving a space and all that directions. But now the patient speaks, and with the help of AI, it can be written down without actually the physician writing it down. This helps in not missing anything, and it helps in the process of entire collection of data from the patient. At the same time, complete generation of prescriptions, preparation of reports, even a complete information about the patient can be done with the help of AI. Then for our research purposes, we need to do a literature review. So instead of searching manually, AI can summarize a lot of this research material available in the literatures, and it can be documented very easily. For those physicians who are training young homeopaths, they are interacting with students, they are giving lectures, expert lectures, webinars. They can create presentations for students, MCQs, quizzes, etc. And of course, for practice management, scheduling of appointments, for all this, AI can be integrated very easily. So these are a few things which a homeopathic physician can do as far as artificial intelligence incorporation is concerned in homeopathic system of medicine. Now, when we come to use of artificial intelligence, there has always been a gaping question. Can we select a homeopathic medicine for a patient directly from artificial intelligence? Now, so for this, I have prepared one example. We'll have a look at this. Hello?
Some technical problems.
It's,
Dr. Kiran.
Kiran, are you there? Kiran?
he's here. Kiran is here.
Sir, I just turned off my screen sharing.
Okay.
I
Can you
think
please?
you can go with the sharing, right?
No, it is not being shared still. Can you please?
Yes, Kiran, you can continue screen sharing.
Okay.
Yes, sir, you can talk now.
No, it is still disabled.
Oh, okay, sir. Okay, sir, we can hear you.
No.
No, okay, sir.
Okay, fine.
Okay.
No problem. Actually, I had prepared one example of using directly artificial intelligence, which was possible only if I could share. But since it is disabled, I cannot see. Okay, we'll continue with what AI cannot replace. What AI cannot replace is that whenever we have a dilemma, that is to say, before going into understanding what AI cannot replace, you must understand that homeopathic system of medicine is basically patient centric and individualization is the core. So whenever we have to take a decision on the basis of these principles, AI may pose a hindrance. So let us say, for example, there are two patients with migraine having same diagnosis, having different personalities, different fears, different emotional state, and they will have a possible different remedy. So when you ask directly to artificial intelligence, depending upon the knowledge which it processes, which is not again the same. So there is always a possibility of three different AI engines giving you three different remedies for the same patient. So for two patients, you may have 6 different remedies. So that is one aspect which should be always remembered. This can be easily understood if you understand that when you have a browser search, if you are using Google, it will give different answers. If you use Firefox, it will give you different answers. So if you are going to use different AI machines, engines, then there is always a possibility of them giving different information. So that is the reason why traditional homeopathic selection of medicine is never going to be done by artificial intelligence. So at the same time, even if such data like individualized mental symptoms in form of silent grief or suppressed emotion or patient's body language or hesitation before answering, family dynamics, physician-patient rapport, all these are even incorporated in AI engines, then also selection of medicine will be possibly erroneous, because each and every AI engine will be having a different set of search criterias and data processing. So that is the reason why we must understand that AI can never replace a homeopathic physician. There won't be any possibility of that, at least in the near future. That is what I perceive. And that is the reason why all those things which Hanuman has still mentioned are relevant in form of careful observation, listening, individualization. So they are the principles which are very difficult to be incorporated in artificial intelligence. Now we talk about the next part, that is changing expectations from homeopathic physicians. Now, as I have shown to you, with recent technological advancements, homeopathic physicians will be asked, will be inquired about adaptation of artificial intelligence, recent technological advancements, because today's patient is different. He is also connected, he has also got a lot of information. So he will have gone through so many different permutations and combinations for his illness, for his problems, for his complaints. So they want certain clarity with clear explanations, scientific reasoning, accurate documentation, efficient communication, which can be very well done with the help of using artificial intelligence. So that expectation from patient can be fulfilled if artificial intelligence is incorporated. At the same time, it will lead to lifelong learning. That is to say, of course, a homeopathic physician always is a student. We keep on learning throughout our life. But with incorporation of artificial intelligence and the ease with which digital information is available, he will become more and more informative pertaining to whatever changes, whatever necessary information he should possess. Then each and every homeopathic physician has to have now what we know as evidence informed practice, because again we see usage of so many evidence based material now available for us. So patient will ask to us evidences pertaining to treatments which we use, testimonials. So with incorporation of artificial intelligence, it becomes easy, or rather it becomes a process of facilitation when you have a systematic approach towards collecting and maintaining evidence. Then another which a very important part is a form of, you can say, better communication with the patient, because nowadays we rely, or rather we also have the facility of having online consultations, but in-person consultations and online consultations will improve, because now we have modern means of communication incorporated with artificial intelligence. However, there is one factor which is very important to consider here, is ethical use of artificial intelligence. Of course, when a patient comes to you, he expects all that he tells you, all that he gives you information about remains with you. Till the digitalization era, you had a surety that whatever data you have collected is going to stay with you, is going to be there with you. But now, with such extensive digitalization and artificial intelligence, this particular ethical use of information collected by artificial intelligence will be a big, you can say, problem, or rather, you can say, an issue which a patient will always have at the back of his mind. At the same time, when we are talking about this ethical use of artificial intelligence, I would like to emphasize that there must be a systematic method by which you must be able to assure your patients that whatever data you are collecting, that will be kept confidential. This remains a very important feature as far as homeopathic physicians nowadays are concerned. Now we come to the next part, which is the risks of using artificial intelligence in homeopathy. See, there will always be risk management, which becomes important in any aspect of life. So the first and foremost risk which each and every homeopath should avoid is over dependence on use of artificial intelligence. You can use artificial intelligence for the processes, data collection, information, but it is not a substitute for clinical knowledge. When you have studied for more than 5.5 years, you have gained sufficient experience, and then on the basis of this, you must be dealing with your patient. There should not be any form of direct dependence on artificial intelligence as far as selection of medicine is concerned, or for that matter, any such process which can be undermining to the ultimate selection of medicine and the management of case. The second thing which should be always kept at the back of mind while using artificial intelligence in homeopathy is that these AI systems are powerful, but they are not infallible. That is, they also have errors. There will be informations, there will be analysis, there will be conclusions which can be misleading. So any such type of process which you have done with use of AI, any information which you have collected must also be fulfilling your clinical knowledge and your understanding pertaining to the illness of patient. The third is individualized process of case taking should not lose its essence. You may ask artificial intelligence in form of information pertaining to which questions can be asked for a particular disease. You can ask questions, but which questions I should ask to my patient if he's suffering from an XYZ disease, or which questions should you ask to your patient when he's giving you family history. But there should not be under any circumstances loss of individualization. This can ultimately affect the outcome and output as far as the homeopathic selection of medicine or management of case is concerned. Another risk which artificial intelligence and technology poses is reduced doctor-patient relationship. With effective communication skills, homeopathic physicians have always been developed a rapport with their patients. It may so happen if over-dependence, over-indulgence of artificial intelligence is done by a homeopathic physician, he may fall prey to this kind of unknowingly errors, and ultimately the quality of patient care will be affected. Another risk which I have already talked about at length is maintaining the privacy and confidentiality of patients. Whatever data, whatever information you collect, with digitalization, there is more and more probability of that data which can be breached and used by some individuals for unprofessional motives, for wrong motives, which should be avoided at all cost. It is your responsibility. With highest integrity, you must be able to fulfill this particular aspect of patient care. So this is an important risk feature which will or should be kept in the mind of homeopathic physicians. We have seen a lot of changes pertaining to weakening clinical skills because of use of AI and digitalization. So again, overdependence, overuse of artificial intelligence over prolonged period of time can weaken clinical skills of a physician. The same applies to getting biased, getting prejudiced with use of artificial intelligence. The sole reason of it being your peers are using, everyone is using, so you also start using it indiscriminately. And over a period of time, you will get prejudiced with certain aspects. So these are some of the important risks of artificial intelligence, which you must be well aware and avoid at all cost. Now, coming to the next part, which is practical suggestions for homeopathic physicians. You must be well aware that now you have managed the risk. So you must be able to adopt artificial intelligence wisely. It must be used as an accessory, and it should never be a replacement for whatever work you are doing. Your work may be enhanced, your work may be uh, time saved, your work may be more full mistake proof with use of artificial intelligence, but ultimately you have to do it. That is one aspect which you must always remember. Applying artificial intelligence wisely for patient management, as well as whenever you are using it for dissemination of information, like you prepare information leaflets, which we are seeing nowadays on social media to a great extent. They are all being prepared by artificial intelligence. So while you are doing that, also you must verify them, use your clinical knowledge, and of course then you can use them. The same applies for summarizing your researches, when you are organizing your case reports. All these particular aspects should be kept in mind, that you are going to use this tool, or you are going to use this only as a tool, not as a substitute. And you must never allow artificial intelligence to replace your clinical knowledge, your clinical acumen, your clinical skills. And these are all the practical suggestions which I think will be very much useful for homeopathic doctors. Now, I think this particular session has been a wonderful session with more and more homeopathic physicians adopting artificial intelligence. However, to summarize, I can say that artificial intelligence or digitalization should be allowed to suggest only a homeopathic remedy. They should never be taken for granted as the sole end result as far as patient care is concerned. It cannot replace wisdom, it cannot replace ethical responsibility. And so we must come to a conclusion that uh, the future belongs neither to those physicians who reject artificial intelligence, nor to those who depend entirely upon it. We have to find a midway where you can use this and uh, combine your scientific knowledge, technological competence, use it ethically, responsibility, and provide a compassionate care so that you can practice holistic healing. Uh, I think this much information is fine for today as far as this topic is concerned. With this, I would like to conclude my. Is there any questions from anyone?
Yes, doctor. It was really an excellent session, and there is actually there are difference of opinion among doctors as well as others about this using this artificial intelligence in all these things. For example, today I got an award from a group of homeopathic uh, people, and the article was written by in Malayalam, and somebody was sent it to one of my friends, and he was in Karnataka. And what he did was he just asked the meta to translate it, and what he got was a different.
Mm.
The writing told that I have written an article on that paper, and it was really an excellent one. And I was made the secretary of the organization. Actually, it was not that. It was written very clearly that I am the chief coordinator of these webinars and not the secretary. So this kind of things can happen. That means that all these things have some problem in the future. So we cannot 100% believe in all these things, but we have to do whatever thing we used to do in our previous years. That is, taking the case in details and should then go to the repetition, and then after repetition, you can compare the medicine with that in the material medica and choose the right medicine accordingly. But as you rightly point out, that you will get two medicine for that from three categories, and that means six medicine will come into the picture, and out of which then you may be able to choose the right one as per the material medica. Am I right, sir?
Yes, sir.
Yes. Anyway, this is what I
There
would.
are some.
This was the point I would like to mention here.
Okay.
Thank you.
Doctors who can observe patients. Okay, yes.
We can invite others also. Dr. Vivukumar Pandasar is always waiting there.
Yes, sir.
Sir, unmute, sir.
Sir, it is a nice innovative presentation. So every doctors of our fraternity, they should aware. Sir, my question is, should it include in syllabus?
Very good question, sir. If it should be rather, but thing is, it cannot be a part of syllabus for the sole reason that it is to be simply used as a tool. So proficiency and efficiency in artificial intelligence and technology development is necessary, but I don't think it should be in a syllabus, because most of the time students are sometimes nowadays more adopting it and learning on their own.
Second thing, sir, as you mentioned, that it is a tool for time saving to justify highest ideal of cure, but can't replace the doctor. But doctors, those who have lack of knowledge of AI, it replace themselves. Is it right, sir?
Yes, sir, of course, because after all, whatever we have studied, if simply any layman or any person not conversant with homeopathic system of medicine goes and tries to search a homeopathic medicine with the help of AI, he cannot justify it. Actually, I wanted to show that only. If possible, I'll try it. Just a second. So still screen sharing is disabled, sir.
You are the co-host. You can do. Let me check once again. I just made you co-host. This way. Yes, you can. You can share it because you are co-host now.
Yes. Okay. Now my screen is visible, sir.
Yes, it is coming.
Okay. See.
Just to share, yes.
Yes. See, this is, sir, if example, if a layman types this simple information, Like find a simillimum for a patient aged 59 years suffering from chronic back pain since last 2 years. The backache aggravates in morning and ameliorates after sunset. The pain is dull. All these are symptoms, okay, which he has collected. Let us say, for example, he knows little bit of homeopathy. He's not a student. He's not a physician. Then he types this information in the AI engine. This is Grok. And this Grok, after only 20 seconds, gives this answer. See, this answer is pulsatilla. But closely remedy like netramure is also suggested. Okay, sir. Now, this is all given as information. But here you can say this Grok is suggesting pulsatilla. Now, we go to another search engine. This is Perplexity. Now, in Perplexity, if you're given the same information, then suggested simillimum for this case is Rustox 30C. So Perplexity gives another answer, Grok gives another answer, and let us say the same information if you give to ChatGPT, it first tells that it is from not possible to identify a true simillimum with certainty. But here the first medicine which that is given is netramure. So you see, sir,
Yes, yes.
So as you
so
sir,
this
as you mentioned, there are different types of AI, but which one is the best as per your suggestion or your experience?
No, there is no best as such artificial intelligence engine for search.
Doctor, have you checked the same veterinary medica with these medicines with the veterinary confirm whether it was Pulsarilla, Netramur or Rustox, because the Rustox is a
No, in classic, see that in classical repertorization, these medicines were shown. I'm not saying they are not shown, but see whether you are going to prescribe Rustox, whether you are going to go for Pulsatilla or something else, this AI engine may narrow down the search. But simply you cannot say that I'll give simply by typing this information and getting one medicine that, okay, I'm going to give Pulsatilla. Because this is now very much evident right in front of you with proof that different AI engines give different answers.
that is the point.
So it is the same for most of the information which you are collecting. Like, for example, if you ask for a diet which can be prescribed to a diabetic patient, there will be differences. So nothing can be blindly followed. You have to use your own knowledge
Exactly.
and take a decision accordingly.
Sir, in allopathy, I have seen that when the patient is narrating, that the AI is listening and the AI is also advising the name of the medicine and the dose and reputation, everything else. Is there any AI in our homeopathy that can suggest like this?
There are special AI adopted, homeopathically adopted AIs, but majority of them are paid. So no free use possible. And as I told you, sir, even if they are using it directly just for selecting simillimum, their reliability I am very much doubtful because of the reasons which I showed to you.
But naturally, it will help us to save the time, sir.
Yes, of course. Repertorization can be done, sir. But that homeopathic software will also do.
So again, it depends on the knowledge of the physician and skill of the physician.
Yes,
Instead of
exactly.
using the paid AI also.
Yes, Mehta sir want to speak to you, sir.
Hello, sir.
Dr. Ammar, has the topic itself is a very difficult topic for the any kind of the explanation, and he is emphasizing the uh, core of the technical support in terms of the selection of the homeopathic medicine, and whatever tools he has described is nicely explanatory. And but one thing is that if physician is having good command in the knowledge, the use of the different kind of the repertory, use of the materia medica, so the limited resources is used by the different consultant in their clinical practice. So use of AI is at times it is very good, but if physician is having good knowledge, versatility, having good knowledge, they can having command in the homeopathy, can having good selection of the remedy. What I suggest, sir.
Yes,
Thakkar, sir.
yes, absolutely.
Thakkar sir, are you using AI in your clinic personally?
Not that much, sir.
That means you are following the traditional way of treatment.
Yes, yes. I'm still not sure about its outcomes.
You are not confident that AI will give the simillimum.
Sir,
No,
that case itself shows the difference. Sir, all the four remedies that come out for a single case, and that too, if you think in our homeopathic point of view, we can see that the Natramur is a hot patient, Rostox is a chilly patient,
yes,
and
exactly.
the pulsarily is it's a, both chilly and warm. That means that changeability is there. That means that you will be a little bit confused. So use your sense after getting this simillimum, whether the patient is hot, then you can go for natural. You can think in the way of natural mode. But if the
Same thing you are using in the traditional way also. So
yeah, that's the
not
only
even
thing.
a single report is complete. So after reporterization, we have to correlate it with Metromedica, and implementing our Metromedica knowledge, you have to finalize the simillimum. So
Exactly.
this procedure we are following also in traditional
But
method.
but
Sir,
sir,
AI can do the second prescription. AI can do the second prescription.
I think it will result into the same process which I have shown with regards to selection of medicine. There cannot be a single opinion about it. That is to say, all different AI engines, because after all, it's a processing unit. So processing unit works on the same principle that whatever you put in, it is going to give out. So what has been put in an AI engine is very important. It will entirely depend upon it. Over a period of time, I think there will be improvements. But as of now, I'm seeing that it won't be at least helpful for giving any kind of first prescription or second prescription also.
You have rightly said that individualization cannot be possible by AI. So AI can give a general statement, a general line of approach, but AI cannot help us to.
That is one of the reasons why in modern medicine AI is being adopted very easily, because theirs is a generalization system. So they believe on diagnosis. Diagnosis is done, medicine can be given. Diagnosis is very easy in AI.
Their
So,
concept
excuse
is
me, sir,
material.
only 1 minute more. We are going to finish it.
yes,
Oh,
we
1 minute more, sir.
we can invite Ramadesh sir to say a lot of
Okay,
thanks
lot
to
of
the
thanks.
patient.
Please, Rambavesh, sir, please.
Please unmute, sir.
Thank you, Dr. Thanesh ji, and Namaskar, Dr. Panda sir, and other.
Namaskar, sir.
Namaskar sir, and congratulations, Dr. AMAR THAKKAR sir. Very nice,
Thank you, sir.
knowledgeable session. AI is the role of multi-medicine selection and a root, a knowledge, and physician is the materia medica, is the knowledge of materia medica. Then select AI medicine. So very thanks, Dr. Amar Thakkar sir.
Thank you, sir. Thank
On
you, sir.
behalf of IFPH whole team, very thanks. Thank you again presentation.
So, thank you so much, everyone. Thank you. It's a really a wonderful session, sir. So thank you once again, Dr. Amar sir. So all the participants, I am from my heart thanking you all. So now it's going to hand over to the Malayalam session.
Before that, there is an announcement for tomorrow. Tomorrow we will have a session from Dr. Mitesh Pijani, and he is a head HOD and professor, Department of Anatomy, Rajkot Homeopathic Medical College, Pearl University, Gujarat, and we'll be talking about trigeminal neuralgia, a holistic approach to homeopathic integration. That means another gift from our Mehta sir to our Rajkot Homeopathic Medical College. Thank you, sir.
So thank you so much. Handing over to Dr. Shaila to continue the Malayalam session. Good night.